101. Which insulin has no peak and lasts 24 hours? A. Lactic acidosis. B. NPH insulin. C. Lispro insulin. D. Glargine insulin. 101. Which insulin has no peak and lasts 24 hours? A. Lactic acidosis. B. NPH insulin. C. Lispro insulin. D. Glargine insulin. 102. Which medication treats hypothyroidism? A. Blocks H2 receptors. B. Levothyroxine. C. Propranolol. D. Propylthiouracil. Answer. B. Levothyroxine. Rationale. Levothyroxine is synthetic tea for use to treat hypothyroidism. 103. What should be monitored with furosemide? A. Hydrochlorothiazide. B. Potassium levels. C. Magnesium levels. D. All of the above. Answer. D. All of the above. Rationale. Furosemide is a loop diuretic that can cause electrolyte imbalances. 104. Which medication is a proton pump inhibitor, PPI? A. Hypertension. B. Omeprazole. C. Sucralfate. D. Misoprostol. Answer. B. Omeprazole. Rationale. Omeprazole is a PPI that inhibits stomach acid secretion. 105. Which drug is a benzodiazepine? A. Beta blockers. B. Lorazepam. C. Haloperidol. D. Amitriptyline. Answer. B. Lorazepam. Rationale. Lorazepam is a benzodiazepine used for anxiety and seizures. 106. Which drug treats hyperthyroidism? A. Flumazenol. B. Levothyroxine. C. Calcium gluconate. D. Alendronate. Answer. A. Methimazole. Rationale. Methimazole reduces thyroid hormone production. 107. What is an adverse effect of albuterol? A. INR levels. B. Hypoglycemia. C. Tremors. D. Constipation. Answer. C. Tremors. Rationale. Albuterol, a beta agonist, can cause tremors and tachycardia. 108. What is the antidote for opioid overdose? A. Haloperidol. B. Flumazenol. C. Naloxone. D. Acetylcysteine. Answer. C. Naloxone. Rationale. Naloxone reverses opioid-induced respiratory depression. 109. Which medication requires INR monitoring? A. Bradycardia. B. Warfarin. C. Apixaban. D. Rivaroxaban. Answer. B. Warfarin. Rationale. Warfarin requires INR monitoring to prevent bleeding complications. 110. Which drug can cause a dry cough? A. Warfarin. B. Lisinopril. C. Metoprolol. D. Losartan. Answer. B. Lisinopril. Rationale. ACE inhibitors like lisinopril can cause a persistent dry cough. 111. What is the primary use of atropine? A. Beta blockers. B. Increase heart rate. C. Decrease blood sugar. D. Treat seizures. Answer. B. Increase heart rate. Rationale. Atropine is used for bradycardia. 112. What is a common side effect of nitroglycerin? A. Methimazole. B. Headache. C. Bradycardia. D. Hyperglycemia. Answer. B. Headache. Rationale. Nitroglycerin causes vasodilation, leading to headaches. 113. Which drug class does metformin belong to? A. Warfarin. B. Biguanides. C. Thiazolidinediones. D. DPP, for inhibitors. Answer. B. Biguanides. Rationale. Metformin is a biguanide that decreases glucose production. 114. Which electrolyte imbalance is caused by loop diuretics? A. Tachycardia. B. Hypokalemia. C. Hypercalcemia. D. Hypernatremia. Answer. B. Hypokalemia. Rationale. Loop diuretics like furosemide increase potassium excretion. 115. What is the antidote for benzodiazepine overdose? A. Nephrotoxicity. B. Flumazenol. C. Protamine sulfate. D. Atropine. Answer. B. Flumazenol. Rationale. Flumazenol reverses benzodiazepine sedation. 116. Which drug class does losartan belong to? A. Naloxone. B. Beta blockers. C. ARBs. D. CCBs. Answer: C. ARBs. Rationale: losartan is an angiotensin receptor blocker, ARB. 117. Which medication is a HMG-CoA reductase inhibitor? A. Sodium. B. Lisinopril. C. Furosemide.
D. Metformin.
Answer: A. Atorvastatin. Rationale: atorvastatin is a statin used to lower cholesterol. 118. What is a major side effect of NSAIDs? A. 0.5 to 2.0 nanograms per milliliter. B. Hepatotoxicity. C. Hypotension. D. Bradycardia. Answer: A. Nephrotoxicity. Rationale: NSAIDs reduce kidney perfusion, causing nephrotoxicity. 119. Which drug is used for alcohol withdrawal? A. Bradycardia. B. Diazepam. C. Haloperidol.
D. Clozapine.
Answer: B. Diazepam. Rationale: benzodiazepines like diazepam prevent alcohol withdrawal seizures. 120. Which medication is an SSRI? A. Atropine. B. Sertraline. C. Bupropion. D. Venlafaxine. Answer: B. Sertraline. Rationale: sertraline is a selective serotonin reuptake inhibitor, SSRI. 121. What is a potential risk of clindamycin? A. Bleeding. B. Hyperkalemia. C. Hypoglycemia. D. Hypertension. Answer: A. C. Difficile infection. Rationale: clindamycin increases the risk of C. difficile colitis. 122. Which drug treats bipolar disorder? A. Statins. B. Fluoxetine. C. Olanzapine.
D. Alprazolam.
Answer: A. Lithium. Rationale: lithium stabilizes mood in bipolar disorder. 123. Which insulin is rapid-acting? A. Hypokalemia. B. Glargine. C. Lispro. D. Regular. Answer: C. Lispro. Rationale: Lispro is rapid-acting, used before meals. 124. What should be monitored with valproic acid? A. Flumazenol. B. Kidney function. C. Hemoglobin. D. Electrolytes. Answer: A. Liver function. Rationale: valproic acid can cause hepatotoxicity. 125. Which drug treats ADHD? A. Rifampin. B. Methylphenidate. C. Phenytoin. D. Propranolol. Answer: B. Methylphenidate. Rationale: methylphenidate is a stimulant for ADHD. 126. Which drug is a calcium channel blocker? A. Hepatotoxicity. B. Metoprolol. C. Amlodipine. D. Losartan. Answer: C. Amlodipine. Rationale: amlodipine is a calcium channel blocker, CCB. 127. Which drug can cause lactic acidosis? A. Tachycardia. B. Insulin. C. Glipizide. D. Pioglitazone. Answer: A. Metformin. Rationale: metformin can cause lactic acidosis, especially in kidney disease. 128. What is an adverse effect of isoniazid? A. Statins. B. Hyperglycemia. C. Constipation. D. Hypertension. Answer: A. Peripheral neuropathy. Rationale: isoniazid can cause B6 deficiency, leading to neuropathy. 129. Which medication is used to treat Parkinson's disease? A. Dairy products. B. Levodopa-carbidopa.
C. Phenytoin.
D. Atropine. Answer: B. Levodopa-carbidopa. Rationale: levodopa-carbidopa increases dopamine in the brain, improving Parkinson's symptoms. 130. What is a common side effect of lithium? A. Hypokalemia. B. Diarrhea. C. Hypertension. D. Dry mouth. Answer: B. Diarrhea. Rationale: lithium can cause gastrointestinal issues, including diarrhea. 131. What is the therapeutic range for digoxin? A. Phenytoin. B. 5 to 10 nanograms per milliliter. C. 10 to 20 mcg/ml. D. 50 to 100 mcg/ml. Answer: A. 0.5 to 2.0 nanograms per milliliter. Rationale: digoxin has a narrow therapeutic range. Levels above 2.0 nanograms per milliliter indicate toxicity. 132. What is a priority nursing action before giving digoxin? A. Tyramine-rich foods. B. Check heart rate. C. Assess potassium levels. D. Measure urine output. Answer: B. Check heart rate. Rationale: digoxin can cause bradycardia, so heart rate should be checked before administration. 133. Which drug is a loop diuretic? A. Loperamide. B. Spironolactone. C. Furosemide. D. Mannitol. Answer: C. Furosemide. Rationale: furosemide is a loop diuretic that promotes diuresis. 134. Which medication is used to treat status epilepticus? A. Fluoxetine. B. Lorazepam. C. Gabapentin. D. Lamotrigine. Answer: B. Lorazepam. Rationale: benzodiazepines like lorazepam are first-line treatment for status epilepticus. 135. What is an adverse effect of phenytoin? A. INR. B. Hypotension. C. Hyperkalemia. D. Hypoglycemia. Answer: A. Gingival hyperplasia. Rationale: phenytoin can cause gum overgrowth and requires good oral hygiene. 136. What should be avoided with MAOIs? A. Omeprazole. B. Tyramine-rich foods.
C. Caffeine.
D. Gluten. Answer: B. Tyramine-rich foods. Rationale: MAOIs interact with tyramine-rich foods, leading to hypertensive crisis. 137. What is the primary use of naloxone? A. Hypothyroidism. B. Treat benzodiazepine toxicity. C. Treat alcohol withdrawal. D. Reduce anxiety. Answer: A. Reverse opioid overdose. Rationale: naloxone quickly reverses opioid-induced respiratory depression. 138. What is a potential side effect of corticosteroids? A. Nephrotoxicity. B. Osteoporosis. C. Bradycardia. D. Weight loss. Answer: B. Osteoporosis. Rationale: long-term corticosteroid use can lead to bone loss and fractures. 139. Which medication is used for tuberculosis? TB? A. Lisinopril. B. Metronidazole. C. Vancomycin. D. Acyclovir. Answer: A. Rifampin. Rationale: rifampin is an anti-TB drug that can cause red-orange body fluids. 140. Which drug is a selective beta-1 blocker? A. Phenytoin. B. Metoprolol. C. Carvedilol. D. Labetalol. Answer: B. Metoprolol. Rationale: metoprolol selectively blocks beta-1 receptors, reducing heart rate and blood pressure. 141. Which drug is used for opioid dependence? A. Hyperkalemia. B. Naloxone. C. Diazepam. D. Lorazepam. Answer: A. Methadone. Rationale: methadone is a long-acting opioid used for addiction treatment. 142. What is an adverse effect of spironolactone? A. High-fat meals. B. Hypokalemia. C. Hypernatremia. D. Hypertension. Answer: A. Hyperkalemia. Rationale: spironolactone is a potassium-sparing diuretic that can cause high potassium levels. 143. Which drug is a proton pump inhibitor? A. Heart failure. B. Omeprazole. C. Sucralfate. D. Aluminum hydroxide. Answer: B. Omeprazole. Rationale: omeprazole reduces stomach acid by blocking proton pumps. 144. What is a major side effect of aminoglycosides like gentamicin? A. Phenytoin. B. Hypertension. C. Bradycardia. D. Hyperglycemia. Answer: A. Ototoxicity. Rationale: aminoglycosides can cause hearing loss and kidney damage. 145. What should be monitored when giving amiodarone? A. Venlafaxine. B. Platelet levels. C. Blood glucose. D. Calcium levels. Answer: A. Thyroid function. Rationale: amiodarone can cause hypo or hyperthyroidism. 146. Which medication treats anaphylaxis? A. Omeprazole. B. Epinephrine. C. Prednisone. D. Loratadine. Answer: B. Epinephrine. Rationale: epinephrine rapidly reverses anaphylaxis symptoms. 147. What is a side effect of clonidine? A. Hypertension. B. Diarrhea. C. Hyperglycemia. D. Urinary retention. Answer: A. Dry mouth. Rationale: clonidine can cause dry mouth and sedation. 148. What is a common side effect of SSRIs? A. Tendon rupture. B. Increased libido. C. Insomnia. D. Constipation. Answer: C. Insomnia. Rationale: SSRIs like fluoxetine can cause sleep disturbances. 149. Which drug is used for opioid withdrawal? A. Beta blockers. B.
Alprazolam.
C. Haloperidol.
D. Phenytoin.
Answer: A. Buprenorphine. Rationale: buprenorphine helps reduce withdrawal symptoms. 150. What should be avoided with warfarin? A. Regular insulin. B. Dairy products. C. Gluten.
D. Caffeine.
Answer: A. Green leafy vegetables. Rationale: green leafy vegetables are high in vitamin K, which counteracts warfarin.